Well, the Human Rights Commission says the crisis of giving children enough food in the Eastern Cape is so bad, it's recommending the Social Development Department raise the child support grant above the food poverty line. It's also suggesting that the Department of Basic Education should try and increase the National School Nutrition Program to children who are in early childhood development centres. You would know how many stories we've seen about children who've not had enough food, particularly in the Eastern Cape and particularly after the pandemic. Dr Eileen Carter is the provincial manager for the Eastern Cape for the South African Human Rights Commission. Dr Carter, good afternoon to you. You conducted an investigation into the food situation in the Eastern Cape around children. What did you actually find?
Afternoon, Stephen. Well, as you've indicated, you've seen devastating reports of children simply being starved. And unfortunately, that was confirmed by our inquiry and our investigation. And we launched our report today, basically making recommendations on what we think must urgently be done in order to address this now.
I mean, it hasn't always been like this. I know we've had a problem with childhood stunting for many years, but that had improved. So from 1994, arguably, around 30% of our children were not receiving enough food to grow properly. That number had slowly decreased to around 20%. Something seemed to change with the pandemic.
Absolutely. Even the numbers we were working on, and the numbers we were provided by Stats SA, by UNICEF, by the Children's Institute, were pre-pandemic numbers. And we anticipate, just as Minister Pasla, I think in July, indicated that severe acute malnutrition has in fact grown, and he indicated towards, I think, almost 25% this year. So the poverty alleviation mechanisms that government has put in place in this respect, the child support grant, it's working. The National School Nutrition Program, it's working. But unfortunately, it's not enough. And it's not rolled out, in our view, to all the vulnerable children that in fact need it.
So what happens if children don't get help? I mean, literally, they have the scars of this. They'll be shorter than they should be. They won't develop in the correct way. They won't even, they won't develop physically, mentally even in some cases. I mean, we're talking about the rest of someone's entire life.
Absolutely. Stunting. I mean, again, the numbers might be much higher now, but at the time of the inquiry, the stunting rate for South African kids was at 27%, 25% in the Eastern Cape. And this would mean we want these children to go to school, to study, to become doctors and lawyers and journalists, and we are not feeding them. So the numbers, again, we've said this before, that it is going to reflect much higher this year, and I've already seen preliminary reports to that extent. But last year, 1,100 children were diagnosed with severe acute malnutrition just in the Eastern Cape, of which about 120 of them died. Now, this is basically kids who are hungry. Now, Stephen, the biggest concern here, though, is the dichotomy we're sitting with. Because we also report, and this is a report that the CSIR provided to us, that approximately 10 million tons of food go to landfill sites each year. So we are not a food insecure country. So we are throwing away food whilst children are starving. And another element that is concerning is government departments are underspending. So we are throwing away food. We are underspending budget that should go for poverty and food relief. And on the other hand, we have starving children.
Are there particular features of this in the Eastern Cape as opposed to other places? I mean, I sort of want to believe that maybe the more urban provinces are slightly better off. I have no facts on which to base that. The Eastern Cape has particular difficulties, got two big urban centres, got a large rural area. We see certain problems with education and schools in the Eastern Cape time and time again. And I imagine all of these problems are linked. If you have a large number of schools still using pit latrines, as we do in the Eastern Cape, I think 1,000 schools at last count, you would probably see around those schools perhaps also an increase in the number of children who are not getting enough food.
No, absolutely. And I mean, if we look at the unemployment rate, parents are suffering. Parents don't have money. Parents cannot feed their children. But the issue is not only that. Poverty in South Africa is systemic, and that's why, although this report and this inquiry focused very much on the Eastern Cape, like I say, this is a systemic issue in terms of children in South Africa, and the recommendations we have made is speaking to this as a national crisis, not necessarily only as a provincial crisis, because, Stephen, currently the food poverty line is 760 rand, but the child support grant is 510 rand. And 760 rand is only to meet the most basic nutrition requirements of a child. But the child support grant has not kept up in terms of inflation, unfortunately. So we are not meeting the needs of these kids. And in terms of our analysis, that is infringing on the basic human rights as called for in terms of Section 28 of the Constitution.
They're probably the two biggest interventions government makes in anyone's life is probably the child support grant, and the other that comes closely aligned with that is the school nutrition program. You want that to be expanded to younger children, so at the moment it only goes to children at school, so grade 1, grade 0 in some areas. What kind of expansion do you think we need?
That's exactly it, Stephen. If you think about, and we again echo this, the school nutrition program is such a successful program. In the Eastern Cape at the time of the inquiry, it fed about 1.5 million kids a year. So it reaches children who need one meal per day at least. So it's very successful. But the children that do not access school yet, the below 5-year-olds, only rely on the child support grant. So there's clear disparity between the kids who don't go to school and the kids who are going to school. And unfortunately, the 0 to 5-year-olds, stunting is very prevalent there, and they are very vulnerable in this time of their life. So ours is to say that there needs to be an immediate consideration whether the National School Nutrition Program can't be extended to the ECD sector very urgently so. And we are also asking, though, that the alternative is, if we can't, in terms of the fiscus now, immediately increase the amount of the child support grant to at least meet the poverty line, the food poverty line. We are asking, can we at least stagger the implementation and start with the 0 to 5-year-olds? Because ours is a view that there's a differentiation currently, and the 0 to 5-year-olds are not getting enough food, whereas at least the ones that are going to school are getting one meal a day.
Dr. Carter, I mean, so to increase that, and it's actually very cheap to do the school nutrition program. It doesn't cost a lot of money. The child support grant does cost a little bit of money, a bit more. And there's endless conversations in our country at the moment about how we would pay for bigger grants, for more expansive grants. On the evidence of what you say, obviously we must do something. The question then becomes, from what you said earlier in this conversation, is that we have government money that's unspent. We have food being tipped into wastefulls. It actually may not require more resources to do both of these things, to get more children getting a meal from government through the education department every day. Education department, certainly the best way to do it. And to increase the child support grant. Are you saying the government probably does have those resources?
So I don't want to comment and venture into that specifically, Stephen, but what I can say is the Constitution says something very clear to us, and it says that this nutrition, basic nutrition, is an immediately enforceable right. Whereas when we speak about adults, for instance, Section 27, we'd have what we call an internal limitation clause, which would say that it is basically linked to available resources. When we speak about kids, it's not the case. So the Constitution basically calls upon government to say, immediately realize this right of the children. So ours is not to say necessarily where you're going to get it. Ours is to say what our Constitution is saying. And we are really calling upon all stakeholders, and not only government, Stephen. As I've indicated, the food wastage, private sector, the NGO sector, to make the connections of potential assistance. We're calling really upon everyone to take hands, because this is an urgent situation we're dealing with.
I wonder, we've been talking about, I mean, some of the stories that have come out of the Eastern Cape around nutrition and, you know, mothers committing suicide with their children, which I actually don't want to talk about because I just physically can't. But the fact is that I don't know, I mean, you've done this report and I'm very glad that you have. I think we should all be glad that you have. Do you think people in government are listening? Is the Eastern Cape provincial government listening? Is anyone in national government listening? We've had a medium-term budget policy statement from the finance minister last week, and I realize he's in a difficult position. The fact is, I'm just so worried about what's going to happen to these children.
Collective effort, Stephen, let's stay positive. So what I'm saying is that we have had the government appear before us under oath during this inquiry, and we have had their support, and the Office of the Premier were there, the Department of Health, they were there, Agriculture was there, and in one voice, all of them echoed the issue here, and that we are perhaps working in silos and we need to coordinate better. We've provided the provisional report to all government stakeholders. DSD has it, education has it, so everyone's got this report now, and there's no time to waste. We will be popularizing this report as well, and we're asking for it to be tabled in Parliament, and we are going to really forcefully try and get the recommendations implemented, because the best interests of children, as called for by each and every convention we are party to, it says the best interests of the children are paramount. So we have to listen to what the Constitution says, to what the current precedent of the Constitutional Court and Supreme Court of Appeal says, and we have to implement measures now. You would have also seen in a part of our recommendations, we've made about 38 recommendations to about 12 different stakeholders. But one of them is to potentially have the province explore declaring this a state of disaster. We can't see that hungry children and children dying of not having food not be a disaster in our country. So, but that we have put to government, we have said that they might want to consider this, because, Stephen, we've shown once during COVID, during the pandemic, that if we come together and we coordinate, we can really make a success out of programs and roll out of programs which save people's lives. And we've put that to the Office of the Premier, to government as well during this inquiry, to say, is it not time for a war room against starvation of children? And we really hope that it does not fall on deaf ears.
Dr. Eileen Carter, thank you. Strong message there. Really appreciate the time. The person in charge of the Eastern Cape for the South African Human Rights Commission.